Let's talk about the long clinical consultation station in the MRCP PACES exam. There are 2 stations, each 20 minutes long, and each carries 28 marks. These stations test all the essential clinical skills: physical examination, identification of physical signs, differential diagnosis, clinical judgment, communication, patient welfare, and addressing concerns. During the 5 minutes outside the station, you'll read the scenario. It usually includes the patient's name, age, and a presenting complaint, such as a headache. Use this time to prepare. Write down the patient's name, age, and their presenting complaint. List 2 to 3 differential diagnoses. Make a note of any can't-miss examinations, for example, fundoscopy and a full neurological exam for a headache. Also, consider if the patient should stop driving, and include that in your plan. You are allowed to take a pencil and paper inside the station. Once you enter the exam room, greet the examiners, sit down, and face the surrogate or patient. Use the 15 minutes wisely. Spend 8 minutes on history taking, 5 minutes on the physical examination, and 2 minutes addressing patient concerns. You may continue history taking during or after the examination. When 2 minutes are left, the examiner will inform you. After the 15 minutes, you'll have a 5-minute viva with the examiners. Let's talk about the exact format and script for history taking. Start with an introduction. Use your surname. Check your role based on the scenario outside, whether you're in the ward, clinic, or emergency. Say, "Hello, my name is Dr. Khan, one of the doctors in the clinic today. May I confirm your name and age, please?" Use 2 identifiers, name and age. Next, set the agenda. Say, "We are here to talk about your health condition. Is that okay?" Then begin with an open-ended question. For example, "What brings you to the clinic today?" Or, "I have gathered from your notes that you have been experiencing headaches. Can you tell me more about it?" Once the patient explains their complaint, express empathy early to make a good impression. "I'm sorry to hear about that. I'll try my best to help you out." Continue with, "Before we get into the details, may I know if you have any other health conditions? If they do, don't explore them at this point. Now explore the main complaint. If it's a pain symptom, use Socrates. If not, use opera." Let's take headache as an example. Can you tell me where the headache is exactly? How did it begin? Did it come on all of a sudden? What were you doing at the time? How would you describe the pain? Is it dull, sharp, or throbbing? Does it go anywhere else? What makes it better? What makes it worse? On a scale of 1 to 10, how severe is it? How long does it last? Any particular time it tends to happen? Then ask about CNS-related symptoms. Do you have any dizziness? Any loss of consciousness? Any weakness in the face or limbs? Any numbness or tingling? Any hearing or speech problems? Any visual issues? Any abnormal movements or jerking? Any loss of bladder or bowel control? Next, check for red flags or systemic symptoms. Any fever? Any lumps or bumps? Night sweats? Weight changes? Trouble handling temperature? Now do a quick review of other systems. I'll ask a few questions. Just answer yes or no. Any cough, shortness of breath, chest pain, or racing of heart? Any joint pain? Tummy pain? Feeling sick or vomiting? Next, ask about comorbidities. When were you diagnosed with high blood sugar? Are you on regular follow-up? Are you taking your medications regularly? May I see your medication list? Any recent changes in medicines? Do you visit your eye and foot doctors? Any previous hospitalizations or surgeries? Any family history of similar conditions? Any drug allergies? Now ask about lifestyle. Do you smoke? How many per day and for how long? Have you thought about quitting? I can refer you to a smoking cessation clinic if that's okay. Do you drink alcohol? How much? Do you use any recreational drugs? What do you do for a living? How is this condition affecting your daily life? We can involve an occupational therapist if it's impacting your work. Do you drive? If applicable, advise them to stop driving, for example, in cases involving vision or seizures. Have you traveled recently? Do you have any casual partners? Do you practice safe sex? If they've traveled, ask about vaccinations and activities like swimming in lakes or eating street food. Ask, is it okay if I examine you? Start with general physical, hands, arms, face, neck, chest, abdomen, legs. Then do a relevant system exam, for example, a full neuro exam with fundoscopy for headache. Sanitize your hands before and after. Ensure proper exposure. Cover the patient after. Finally, ask, what are your main concerns? Answer clearly and without jargon. Afterward, during the viva, the examiners will usually ask about your differential diagnoses, investigations, and management. If you found this helpful, share it with colleagues. For templates, daily tips, or mock sessions, follow PACES guide on Instagram or message for one-on-one coaching.